Hi, everybody. Today we are answering the caregiver question, are hip fractures for elderly parents serious? As with other medical conditions, the answer is it depends on a number of factors that we're going to talk about here today in this video. Stay with me. I'm going to share information about hip fractures and how they affect elderly parents. I'm Pamela D. Wilson. My website is PamelaDWilson.com. On there, lots of helpful information for caregivers and aging adults. My online courses, podcasts, videos, caregiving library, my blog, and more detailed answers to this question of are hip fractures serious will be in an upcoming podcast on the caring generation that will show up here on my YouTube channel. So check back. When an elderly parent fractures a hip, the hip fracture could be the result of an accident. Maybe mom or dad tripped or slipped. Maybe they lost their balance, could have fallen out of bed, or simply just turned to walk and fell. Hip fractures for the clients that I've helped over the past 20 years have happened for a number of these reasons. So I want to talk about recovery statistics that hospital surgeons don't usually like to share because they can be worrisome. So according to research, the 1-year death rate for an older adult who has hip fractures is between 20 to 30%. That's a pretty significant number. And we'll talk more about why this happens. Statistics from research by Murthy at the University of Pennsylvania also confirm that after surgery, 20% of people are going to have a significant decline and just not really recover. 40% will walk as well as they did before, and another 40% are going to walk a little bit worse. So when you hear these things, you may think, wow, hip fractures, they not good, right? They're not good. And honestly, the time to recover from a hip fracture can be 6 to 12 months, but only if if your elderly parent is very persistent with doing their physical therapy exercises. So it really is a big life change. And let me compare this to something that you might be familiar with if you're younger or that you might have heard about. So if you're active, if you water ski, mountain bike, go to the gym, do other activities, you might have heard of somebody having a rotator cuff tear, which is a shoulder injury. And so for a typical rotator cuff for a younger person, it can take 3 to 6 months of ongoing and aggressive and significant rehab and exercise to recover so that really you can use that arm as well as you did before. Now, if you're 70 or older, the recovery time lengthens to 6 to 12 months. So age makes recovery times longer. And now the recovery is dependent, though, on therapy and each individual's willingness to do progressively more and more and more work to regain full movement of the shoulder, just like a person who's having a hip fracture has to regain the ability to walk and full motion in their hip and flexibility and all of that. The point here is that recovering from any serious injury takes a lot of work. And depending on the age of a parent and the type of fracture, your parents may or may not be motivated or willing to participate in therapy and endure the pain that rehab takes. So then what happens? Well, many older adults then don't regain the ability to live independently if they were not physically active and in good condition before the surgery. And I talk about this a lot. The more physically active you are throughout your life, the healthier you are throughout your life, the less any type of health condition is going to affect you because you're going to be proactive about it, right? You hear me talk about this all the time. So let's say that a parent before a hip fracture used a cane. After that, if they're not proactive, they may end up using a walker. If they used a walker, they may end up in a wheelchair. So let's talk for a moment about the surgery because this is important too. It's usually scheduled within 48 hours because the quicker the surgery is done, the better the results. But if your parent has a lot of health conditions, there's a greater risk, especially if they have dementia. The anesthesia can make their cognition, their memory worse. And so after that surgery, your parent may be more forgetful. They may remember less. They may be less able to participate in the physical therapy to get better, which means you as a caregiver are going to have more work to do to get mom or dad back to the physical condition they were before to get them back on their feet. And this is practical information that everybody should know. So taking a step back again, the type of surgery that your parent receives is up to the surgeon. Surgeon's going to want to know how active they were before the hip fracture. If they sat around all the time, they may not get a full hip replacement. So the options are a full hip replacement, they can do a pin, or they can do nothing. So when I consistently reinforce the idea of being in good physical condition, cardio, strength, the quality of your health determines the treatment that you're going to get. It determines the treatment your elderly parents are going to get. If you want good treatment, you have to work on your health. So for all of these reasons, hip fractures for the elderly are complicated. They are serious, meaning that life after a hip fracture can be very difficult to predict. Most older adults after that stay in the hospital will go to a nursing home for rehab for a few weeks. And this gives you, the children, the caregivers, time to figure out what to do, right? Can mom or dad go back home and live independently? Are they going to need caregivers coming in? Do we have to look at an assisted living community? Is a nursing home going to be the only option? So are hip fractures for elderly parents serious? In most cases, the answer is yes, if your parents were not in good physical condition or active before that hip fracture. It's a life-changing event. So as a caregiver, the more educated you can become about the surgery, what happens next, that will help you develop a plan of care for after your parent has that surgery and what the next 6 months, 12 months, year, 2 years might look like. I'm Pamela D. Wilson. My website's PamelaDWilson.com. A lot of helpful information there for caregivers and aging adults. And here on my YouTube channel, hundreds of videos like this that answer questions caregivers ask. Please press the share button. Share these with other people you know who are looking for help, and support. And follow me on YouTube. Have a fabulous day today. I'll see you all again soon in another video.